Good afternoon and welcome to the COVID-19 update on Channels Television. It's a daily update on the coronavirus pandemic in Nigeria and across the world. I'm Millicent Nwaka. First, some of the highlights. Today, no respite yet as NCDC confirms more COVID-19 cases. Defaulters of restriction order in trouble as Lagos State makes over 100 arrests. And on our theme today, we celebrate the nation's health workers battling to flatten the COVID-19 curve. Now, many are worried about the rising coronavirus cases in the country. On a daily basis, the NCDC rolls out figures of new cases across the country, while precautionary measures must be taken to flatten this curve. Today, we'll be joined by guests on how Nigerians can reduce the spread of COVID-19 and how our health workers who are on the front line battling this pandemic can be better protected. 2,950 COVID-19 cases, that is the number of confirmed cases in Nigeria following the confirmation of 148 new cases by the Nigeria Center for Disease Control NCDC last night. According to the center, 481 patients have been discharged from various isolation centers and a total of 98 deaths recorded. The 148 new cases are spread across 16 states. Currently, Lagos remains the state with the highest infections, both in the southwest and the country, with a total of 1,226 cases, followed by Kano in the northwest with 397 cases. Next is the Federal Capital Territory, North Central, with 307 cases. Borno has the highest figure in the northeast. Edo leads the states in the south-south, and Enugu leads the southeast, maintaining its 8 cases. Adamawa State has recorded 7 new cases of the coronavirus disease. This was confirmed by the Secretary to the state government, who also doubles as the chairman of the Adamawa State.
How do you mobilize the patient on
meeting?
You normally bring out the stretcher. How do you...
As of yesterday, Adamawa has 6 positive cases confirmed, all of whom are in the treatment center. We had sent 63 samples to the lab in Abuja 3 days ago. As of last night, 40 out of the 63 results were returned. Out of the 40 that were returned, we have 6 additional positive cases. By that, Adamawa has 12 confirmed positive cases of COVID-19 patients in the state. As we speak now, all the patients are being moved to the treatment center. 5 of them are all from Mubi, who are contacts traced to the initial case from Mubi. 1 is from Lamu, the local government.
And for the state in the southeast that has the highest number of cases, Enugu State, the governor, Ifeanyi Ugwuanyi, has officially activated the state's diagnostic center designated for the treatment of COVID-19 should the other isolation centers in the state get overwhelmed. He was speaking while receiving some support from the Nigeria Private Sector Coalition Against COVID-19, a joint initiative of the Central Bank of Nigeria and private sector leaders who provided some hospital equipment for the isolation center. Well, let's tell you what's happening in the south-south. Our correspondent, Dobra Timiwood, is in Bayelsa and brings us this update.
We have been informed by the members of the Bayelsa State COVID-19 Task Force that the 5 cases in the state are all under stable conditions. And contact tracing has begun and more samples have been sent to ensure that further spread of the virus does not occur in the state.
We all know we have 5 active cases. They've all been admitted at our isolation center, at the Niger Delta University Teaching Hospital, Kolobri, and I can confirm they are all in perfect state of health. They are doing well. Presently, they don't have any symptoms, and we're happy with how they have managed with our healthcare worker, how they have also accommodated all our medications and all the advisories we've given to them. We're going to give them a couple of days. If they still remain symptom-free, then we might have to repeat the test, and then if the test becomes negative, we repeat it again. So if we have 2 negative tests, then we could discharge them. We're also following up the contacts to these other new cases, and we have over 100 contacts that we're following up. And I think basically for most of them too, they have been placed on self-isolation, and they are keeping to all the protocols of self-isolation.
Allaying the fears of most residents of the state, medical practitioners are saying that contacting the coronavirus is not a death sentence. Like every other virus, it would stay out its time in the body, and that the medical practitioners in the state are well equipped to combat every symptoms that arises from the virus. They are calling on Bayelsans to stop the trend of self-medication, as it can be more dangerous than the coronavirus. From Yenegua, Dobra Timiwood.
Well, staying with the COVID-19 pandemic and the need to flatten the curve, the CEO of Outreach Group of Hospital, providers of acute health care to women, babies and children in 5 centres in Lagos and Delta State, Dr. Efunbo Doseku, joins us on the program. Now, Dr. Doseku is a renowned pediatrician, the acting chairman, Society of Emergency Care Practitioners, and a partner, Vesta Healthcare Partners, a health management consultancy company. She is passionate about advocacy for innovative health system development in Nigeria, particularly in areas of primary care, emergency care, and human resource capacity building. Dr. Efunbo Doseku, welcome to the program. Doctor, we've been told that the pandemic will stay with us for some time. We've also been seeing, or started to see, infections amongst children. Jigawa State yesterday, a 6-year-old girl, daughter of an index case, and then several Almajiri children also across the northern region. How does COVID-19 affect the child?
COVID-19, for some reason, at least at the beginning of the epidemic, children were not affected. But as the epidemic goes on and infects more people, there's going to be increased contact, and eventually children will be affected. But there was something protective at the beginning, but I think the scene has changed.
And it's not as if the virus has changed, no?
No. For now, I don't think we have much information, scientific information on mutations. I think it's just a history of, or what we're noticing now is that the more you have physical contact, you know, because we as humans are acting as the transmitters. So if your children are in close contact with you and you are infected, there is the risk of that child being infected.
We've taken a decision to still shut down schools,
Yes.
but we know that children always play and, you know, they're always friendly and all of that. How does the virus affect the child such that we can limit the spread?
I think that is why there's been a bit of a hold-up in most countries about children going to school. And if children are going to go to school, there needs to be some very clear instructions. It has to be a command type of style. It might have to be the NCDC or maybe the primary care agency. There has to be the advisor and the monitoring, and they would be taking action. There must be some central point that would give the instructions, would monitor, would advise on what to do. So I think if the schools are going to be, if they're going to open, I don't know when the federal government is going to give that initiative for that to happen, we have to be very careful. And we might have to continue doing the infrared temperature testing before the children come to school.
Washing.
We need to do the hand washing. So there might have to be some change in the infrastructure in our schools, because it might be wise to put, like outside my hospitals, there's a station where you can wash your hands now, and we might have to have that for the school children. And things like sporting activities, we might have to put a hold on that, where there's going to be a lot of contact. And we've got to be very sensible. If not, the disaster can continue.
So it will be a different world for our children.
Yes.
So if a parent or a guardian notices that, their child has COVID-19, what are they supposed to do?
I think quite a lot of times they're not going to know the child has COVID-19. They're just there's going to be a fever, or there must be some respiratory symptoms. I think the first thing is parents have to be a bit extra, aware of how their child is performing. We've got to be very sensitive. And if the child has a fever with respiratory distress or significant diarrhea, you must call your hospital. Most people at least have some physician they can call on to when there's problem. I think it's better to route it through the physician than through the pharmacy, because then they can really go through the clinical symptoms and signs and decide if this child needs to go to an isolation center. But I must tell you that this is going to be very difficult, particularly for us in the tropical countries where fever in children is very common. And most of the time it's due to malaria, a diarrheal illness, or a bacterial infection. And so we don't want to have the case where the child is waiting at home while that disease is ravaging the child's body, only to be told a few days afterwards that, don't worry, your child is not COVID positive. So there has to be a lot of sense in this, and a lot of guidance has to be given by the physician.
Does the virus affect a pregnant woman differently, and can she pass that on to her unborn child?
Generally, when pregnant women do get an infection, the symptomatology and the effects is normally worse, even with malaria, with bacterial illness, with viral illnesses. So that can happen too, and I think it has been reported even in Nigeria as a case study, and it can spread to the fetus because there's just one communication, a common communication called the umbilical cord, between the mother and the fetus. So.
And also a nursing mother as well. So let's talk about perhaps what children can take, and even adults. We've heard about vitamin D. It's been a sort of precautionary measure.
Yes.
What's your take on that?
Yes. This is quite topical now, because the events of the last few months have a lot of people, both public health public health officials or leaders, policymakers, academia, scientists, and we're all looking for I would say, like the Holy Grail. What can we do not to have? And I don't think anybody has any single scientifically proven. It's just, there's been some science work and there's been some association. But I think the story of vitamin D, at least in Africa and Nigeria, is one for a scientific conversation. Because vitamin D they call it the sunshine vitamin, and it is known to help the immune system. When I was in medical school 40 years ago, the only function we knew vitamin D had was bone metabolism. That is, to make our bones strong. And if you don't have enough vitamin D, the children have soft bones and they become bow-legs and have swellings at the wrists. And if you're an adult, you have weak bones. They call that osteoporosis. But along the years, there's been a lot of work done on vitamin D, and we find that it does support the immune system. It helps our immune cells to fight. And there's another very important function. When you have an infection, for most people, the immune cells contain that infection. You pound that pathogen, and that's just the end. So you're a bit sick. You could recover on your own, or you might require some antibiotics or antivirals or antiparasitic drugs to help you. But on some occasions, which might be because of the pathogen, like this pathogen, this novel virus is so virulent, or it may be that the host, that is the patient, his immune system is very weak due to some illness or due to poor nutrition, or due to even depression. Depression has been associated with a reduced immune state. So what vitamin D does now is that it helps to support. So people are out there now, the scientists are now saying, so should we not be advocating for people to have good levels of vitamin D, especially when we know it, you can get it free from the sun.
Okay.
15 minutes contact with the sun in the morning.
So between 7 and 8.
Will enhance your vitamin D levels.
Okay.
So it's only sensible to say, let's do all the little things that will boost your immunity. So if this bug comes, our immune system will be able to crash it off.
We'd like to thank you, Dr. Efun Bodeseku. Thank you for joining us on the program.
Thank you.
And when our COVID-19 update returns, Lagos police make massive arrests on violators. Lockdown ease directive. Do join us again for more. Welcome back. The first batch of returnees, 265 Nigerians from Dubai, the UAE, are expected today. They are to arrive at the Murtala Mohammed International Airport, Ikeja, Lagos at 3 p.m. through the Emirates airline. According to the Ministry of Foreign Affairs, adequate arrangements for hotel accommodation in Lagos and Abuja have been made for the evacuation exercise. The selected hotels have been inspected, certified by the Port Health Services, Nigerian Civil Aviation Authority, the NCDC, the Office of the National Security Advisor, and the Ministry of Foreign Affairs. The ministry also says that the process of evacuating willing Nigerian nationals outside the country will be in accordance with global best practices and the guidelines on COVID-19. The evacuees on arrival in Nigeria are expected to undergo a mandatory 14-day supervised quarantine in a monitored environment. More Nigerians are expected to come into the country in the coming days. And across the states, varying measures to curb the COVID-19 pandemic. Let's begin with the donation by the Northeast Development Commission. The Taraba State government received 2 ambulances, food items and medical consumables. The effort, according to the commission, is to complement state government's bid towards fighting the public health crisis of COVID-19. The state government, on its part, promises to judicially utilize the donation, saying that the ambulances will be deployed to the isolation centers in Taraba State. And the Nigeria Police Force Yobe State Command has flagged off distribution and compulsory use of face masks to its personnel to curb the spread of COVID-19. The Commissioner of Police, Mr. Shahibu Abubakar, says 1,500 face masks have been produced in the face batch, which will be distributed across the area commands and divisional headquarters in the state. The Benue State Governor, Samuel Otom, has called for strict enforcement of interstate border closure between Benue and Enugu states, following lapses he observed while inspecting operatives deployed to man the border. The governor's visit to the border points between Benue and Enugu states at the Orokam and Odbolo comes on the heels of a second case of COVID-19 recorded in the state, returning from Kano, which the governor warns operatives against allowing anyone through the border points into the state. And finally, Kano State, 3 COVID-19 patients have been discharged from its isolation center, while 8 deaths have been recorded. Meanwhile, more health workers in the state have tested positive for COVID-19 while attending to patients at the National Orthopedic Hospital, Dala, as well as the Aminu Kano Teaching Hospital in Kano. A total of 27 health workers, including doctors, nurses, and lab scientists. In the meantime, the Association of Hospital and Administrative Pharmacists of Nigeria are commending the federal government for the proactive measures taken so far to curtail the spread of COVID-19 in the country. According to them, the lockdown imposed on Lagos, Ogun, and the FCT went a long way to checking the spread of the virus, which they say contributed to the fewer cases reported during the lockdown. They also commend the Nigerian people for the huge sacrifices and resilience while the lockdown lasted. Now, one of those who believe the frontline health workers are not celebrated enough is Professor Epiphany Azinge. He says that if we must flatten the curve, now is the time to celebrate the doctors, the nurses, other healthcare workers treating COVID-19 patients. Professor Epiphany Azinge is a renowned lawyer, graduated from the University of Lagos in 1976 with a second-class upper degree, proceeded to the University of London for his master's degree, specializing in comparative constitutional law. Professor Azinge joins us now on the program. Thank you, Professor, for joining us. Joins us from our Abuja studios. Now, Professor, you are of the opinion that our healthcare workers should be celebrated. A lot has been said about that and the different ways other countries are doing this. Is there a special way you think that this should be done here in Nigeria?
Very well. Yes, firstly is to say that, of course, in some of the speeches made by Mr. President and some other high-ranking officers, a lot of kudos and commendations seem to have been demonstrated or shown to the frontliners. But I still feel that flowing from what obtains in other climes and jurisdictions, that a lot can still be done. Nigerians need to come out in unison to celebrate our frontliners. The risks attendant to what they are doing is enormous. And indeed, in some instances, we've noticed that a good number of them pay the supreme sacrifice. So it's not just to be laced with speeches. We have to demonstrate it, because psychologically that has a capacity to motivate and propel them. And they can go in believing that they have the whole nation behind them. And to that extent, they will give in their best shot to make sure that they move in and achieve the result that they are there to achieve. Yes, the question is there any special way? I believe that what other climes have done is just to find a given time, a specified time during the day, on a particular day, to just come together all over the world and all over the country and clap in their honor, in their support, or to pay tribute to them. But beyond that, I believe also that we can use our national flag as a symbol of appreciation and to demonstrate heroism one way or the other, because in all honesty, they are the heroes and the heroines of our time. Those doctors in the front line, the nurses, the pharmacists, the lab technicians, amongst others, even the police people, the officers of NCDC, and all the other people from the health sector, they are doing so much in our favor, in our honor, and they should be so widely acknowledged and recognized in Nigeria. So whichever way we designate, whichever way we agree upon, I believe that the advocacy or the movement we are propelling or pushing is that a date in the week, preferably a Wednesday, and you can choose a time, maybe 5 p.m., and that may be the adequate time for Nigerians to agree to stand up and applaud these people, wave the national flag, clap them out, and then tell them thank you for a job well done and for the good job they continue to do throughout this period.
I wanted to quickly get your point of view, if you can, in less than a minute, and that's because our health workers are still getting caught up in the virus. What do you think is responsible, and perhaps do you think that we should put in legislation to compel government to protect the front lines, against this pandemic? Very briefly.
Well, I don't think that is a matter of legislation. I think ordinary policies direction in that regard can assist. Maybe we can motivate them in various ways. I think we've already started along that line. Insurance is one very important one. How do you take care of anyone who dies in the front line? Is there any way you can compensate the family adequately? I believe some of those things put together as a policy directive can help in a long way. I don't think it is a matter for legislation, but if it can come under the new legislation that is being proposed in the National Assembly, I think that also will suffice in the circumstance.
Right, we appreciate your time. Senior Advocate of Nigeria, Professor Zinge, thank you for joining us on the program.
Thank you for having me.
And it's like a bad dream for some residents of Lagos who got caught in the web of police enforcement for breaching the COVID-19 guidelines. Over 150 persons were arrested for violating the directives following the lockdown ease. Will take responsibility in protecting your health, says the NCDC. You can practice physical distancing by non-contact greetings, maintaining at least 2 meters between yourself and others. Stay home if you feel unwell. Call your state hotline. Also, no religious or social gatherings. The website has all the information and stats on the cases across states. Also, the World Health Organization has rolling updates on the pandemic, strategies and plans. Each moment, it keeps updating. You can take a closer look at the numbers in real time. That's our COVID-19 update. Join us again at 6 p.m. for another update. I'm Millicent Wonka. Thanks for watching and stay safe.